Hello all, I'm here with you with key updates and recommendations on the infections, mortality, recovery due to coronavirus infections among Nepali community around the world, and also some key recommendations and findings and messages on staying healthy and not getting infected. And I'm here, Sanjeev Sapkura, representing the Health Committee of Non-Resident Nepali Association. So as of May 16, 2020, the majority of the infections are here shown in this map from around the world among Nepali population. So as you can see, yeah, almost 2,500 people are infected in the Middle East, especially in Qatar, where like high concentration of Nepali population and migrant workers are currently there. Next is United States with almost 1,600 people infected, followed by United Kingdom, and the others are the Saudi Arabia 674, Bahrain over 300, and also in Nepal close to 300, UAE, Dubai 200, Kuwait 84, and also Malaysia 55, Portugal 29, Spain and Canada 13 each. And as you can see in the map, those are their mentioned there. Among the population in Africa, we have not yet gotten any information about any infections there among the Nepali community. Also in South America remains uninfected in the continent in terms of Nepali population. Okay, this graph gives you a better picture of the infections and across the globe. Again, the three most infected countries for Nepali population are Qatar, USA, and United Kingdom, followed by Saudi Arabia, Bahrain, UAE, Kuwait, Malaysia, Portugal, Ireland, and as you can see in this graph, the places where the higher number of infections also corresponds to the higher number of Nepali community. For example, in the Middle East, especially in Qatar, there is a high density of people of Nepali origin working as migrants, and also in surrounding countries, Saudi Arabia, Bahrain, UAE, the Nepali populations is increased in terms compared to other regions. This graph shows the distribution of infections across the world. Again, predominantly Middle East, over 50% of people are infected. Of 50% of the total infection of Nepali community around the world is in Middle East, followed by Americas region, especially in the United States, over close to 25%. And Europe almost 19%, and among Europe predominantly United Kingdom. And one thing to note is Africa, still no infection reported. Oceania, that constitute the Australia, New Zealand, and other surrounding Pacific islands, the infections are low there as well. And Asia, that includes Nepal, the infection is kind of rising, and especially in Nepal, we have seen over the past few days the infection has increased. This graph shows the fatalities, and predominantly in the Europe, 68%, and in United States, 16%, and followed by Middle East. One thing about Europe is where United Kingdom, and especially among our former Gorkha soldiers, they are actually very much targeted actually from this infections, and the majority of the deaths of the Nepali origin actually has occurred among them. The reason being, they are in the older group, and then being older, they more than likely have multiple underlying causes, and the corona infection actually attacks and then makes a person severe already have infection or a disease like diabetes, heart disease, asthma, and all. So the reason why we see a high rate of fatalities among the Gorkha soldiers, who are in their 60s, 70s, and 80s, is because of their underlying causes and underlying conditions they have. And sadly, one very unfortunate cause of death has been suicide after a person who learns about corona infection. There has been 4 so far among Nepali community, and that is very sad. A person attempting suicide after learning he or she is positive is very sad, and we each of us in all areas have a role in preventing any attempts made by people who are vulnerable and who are likely to commit suicide. And we can all do something to stop that very soon. So the key messages and recommendations this week, again, it remains the same as last week. The chances of any healthy person getting infected is very high. So if you are healthy, that's great. And if you're not infected, that's great. Try to remain that way, because a healthy person's getting infected is increases many folds if we go outside, and if we are in behavior or activities that puts us at risk. And we all know what how it is transmitted and how it is not transmitted. So the reason, if a healthy person get infected, could be either he or she is not doing enough or not knowing actually. And then I doubt anybody does not know on how it is not transmitted or how it is transmitted. The thing is that we all have to take all preventive measures that we could do to stop being. And these are, again, the same thing. We all know cover nose and mouth, and every child knows now. So that is as simple as it is, but we probably do not do it adequately or not serious enough. So need to close your nose and mouth whenever you are out in public. If you do not have surgical masks or the regular masks, and any cotton cloth can be used to cover. The covering helps in several ways in not getting infected. B, think any stranger you do not know as if he or she has infection, so that you take all the measures not to get infected. So going outside, grocery, public places, cover, and stay in a distance and at least 2 meters away from any strangers who you do not know. B, do not panic or worry or be anxious if you are infected. First thing, if you are suspected of infected, get testing as soon as possible. In the meantime, remain calm. Know that 80% of people who are infected, have mild to moderate symptoms, 80%, and then your chance of getting recovery is very, very large. Only 20%, especially among those in the older age group and among those who have any underlying health conditions, diabetes, heart disease, are the people who are going to get more sick and going to get hospitalized. We have seen data that people are going to hospitals and taking treatment late in the game. Don't do that. Take all the measures and all the means to get treated as soon as possible once you identify yourself as being infected. C, touching nose and mouth is absolutely no before washing your hands with soap and water. You can touch your nose and mouth, yes, but your hands has to be clean. Has to be, before you touch nose and mouth and eyes, make sure your hands is washed thoroughly, at least 20 seconds with soap and water, because soap kills the virus. And only then you're allowed to touch your nose and mouth. So 3 things: covering, staying away from a distance of from strangers, and washing your hands before touching nose and mouth. These are the 3 major things that prevents you from getting infected. Again, I'm repeating myself. If you are infected, no reason to panic. Take medical attention as soon as possible. And again, a repeat message about those who come for the suicidal people. Again, it's very sad that people commit suicide after learning being positive. So we need to identify any at-risk person who is likely to commit suicide after learning he or she is positive with corona infection. There is no need to panic. There is treatment out there. So we all have a role in identifying the person and helping, supporting, increasing their in their confidence and helping them get treated soon. Each of us has a role in slowing and stopping the pandemic. This is gonna be over, and that day is not very far when this is gonna be over. But we all have to play a role, and we each have a role in slowing and stopping the pandemic. We have to make sure the healthy people are not infected, and those who are infected are treated as soon as possible. Thank you again from Health Committee of NRN. Thank you again, Sanjeev Sapkota from Health Committee of NRN. I'm going to be here again next week.